Dr. Shela Hirani and her team acknowledge the support of the Social Sciences and Humanities Research Council and the University of Regina that funded this project. This study was undertaken in Saskatchewan, Canada, which has a noticeable increase in refugee families with children of all age groups. This video shares the parenting challenges of refugee families in Canada during the COVID-19 pandemic and presents their recommendations on need-based support for refugee parents during this vulnerable time. Isolation. Refugee parents shared that during the COVID-19 pandemic, they felt isolated due to physical distancing and limited socialization with people in their social network. Many refugee families could not unite with their families due to travel restrictions, which increased their stress level. Fear. Refugee parents shared that during the COVID-19 pandemic, they could not send their kids outside in the playground, fearing that their children would catch the infection. Closures. Many parents who had COVID-19 infection were fearful of what would happen to their kids if they die, get hospitalized, or transmit this new virus to their kids. Refugee parents further shared they were fearful of getting the newly announced COVID-19 vaccine, as no one could properly explain to them the risks associated with this new vaccine. Refugee parents with school-age children shared that the COVID-19 pandemic compromised their children's learning experiences due to school closures and COVID-19 measures in the learning environment. Parents were concerned because the closure of outdoor activities led children to spend more time at home on electronic devices, which negatively affected their learning, temperament, socialization, and language skills. Refugee parents with adolescent children shared that the closure of youth programs and success centers affected their youth's career choices and delayed their university admissions. Economic challenges. Refugee parents faced many economic challenges due to job loss and reduced income during the pandemic. Looking after their grocery bills, childcare expenses, and cost of housing was the biggest challenge. Many refugee parents who lost jobs during the pandemic had minimal or no financial support to look after their overall expenses. Due to economic challenges, many refugee families in our study were living in overcrowded housing that was negatively affecting their children's education and learning experiences. Refugee parents with multiple school-age children attending online school shared that it was challenging for them to buy online devices for their kids due to economic hardships. Parenting pressure. Refugee parents with school-age children shared that during the COVID-19 pandemic, it was challenging to prepare their children for school assignments and online tests, as many of them lack capacity or have a language barrier. Many refugee parents who were working or returning to work during the pandemic faced babysitting issues. A few families had to leave their young kids home alone to earn their living. Many refugee parents had no babysitting option available for their young babies, which increased their challenge to visit grocery stores during the pandemic. Refugee parents who had children with medical conditions, compromised immunity, or disability felt add-on pressure to cope with the COVID-19 pandemic. Parents shared that it was challenging to ensure close monitoring of COVID-19 symptoms among their kids, especially when they were returning to school. Refugees shared that their parenting pressure during the pandemic was so intense that they often had fights with their spouses on childcare matters. A few refugee couples ended up in divorce during the pandemic, which negatively affected their children's health and well-being. Healthcare challenges. Refugee parents were unable to access healthcare settings due to COVID-related restrictions and long wait times, which negatively affected their health and well-being. Many refugee mothers with young children struggled with busy helplines and the non-availability of breastfeeding counseling services in their language. Refugee parents also faced difficulty in getting doctor's appointments and securing a family doctor during the pandemic. Ways to support refugee parents during the pandemic. Refugee parents recommended parental support programs during the pandemic, especially online technological literacy training and language classes for refugee parents. Support from the educational system during the pandemic is also recommended. Refugee families with school-age children must be offered free access to technology, the internet, and resources for online classes and exams. Support from the educational system during the pandemic must also include teacher support to refugee parents and their kids. Refugee parents recommended support from the healthcare system during the pandemic. Telehealth consultation facilities in different languages are helpful in situations when face-to-face consultation is not possible. Refugee parents shared that there should be more opportunities to gain awareness of COVID-19. Regular updates on COVID-19 and safety measures in their languages were recommended. Our participants recommended that there should be more opportunities for the refugee families to avail social support through social media, which is effective in establishing their connections with relatives, friends, and healthcare providers. Support from social services during the pandemic was also recommended. Our participants recommended that refugee parents must be offered childcare benefits and financial support to cope with joblessness and extra expenses during the pandemic. Support from the community and neighborhood was highly appreciated and recommended for the refugee families during the pandemic, especially the provision of help in babysitting and grocery shopping during family emergencies. Refugee families must be offered opportunities to practice faith and connect with their religious communities during the pandemic. Faith-based spiritual practices are reported to help refugee families develop resilience.